Hello and welcome back to Proactive New York. Joining me this morning is Gerald Commission, CEO at Todos Medical. Gerald, great to see you again. How are you?
Doing well, thank you. How are you?
I'm great. Thanks for asking. Gerald, we have seen the company put its COVID antibody, COVID variant, and now it's Lyra influenza and Lyra RSV and HMP PCR kits into production. Bring us up to date on the various test panels you now have readily available.
Sure. So we have a PCR panel, which includes PCR, COVID, and if you have positive, then we reflex to the variant kit, so we can tell you which strain of COVID you have. We have the antibody panel, which right now includes both the CPAS neutralizing antibody titer test, so we can tell you the quantity of neutralizing antibodies that you have, which is really the only key measure of neutralizing antibodies that matter, as well as a classic IgG/IgM antibody test, and that will tell you whether or not you've had COVID. So the strategy there is that many people come in, they take a neutralizing antibody test because they have had the vaccine. They want to see how the vaccine is working, whether they need a booster. But at the same time, they don't really know if they've ever had a breakthrough infection. And so it's that other IgG/IgM nucleocapsid antibody test that will tell you, hey, this is not an antibody to the spike protein, it's an antibody to the nucleocapsid. The only way your body could have seen nucleocapsid is if you had the virus. So that gives us a better understanding of breakthrough infections. And then finally, we have the respiratory panel. So typically that will be ordered by pediatricians. So when you go in and you're symptomatic and there's a high probability it could be something other than COVID, what you don't want is to just take a COVID test and then, you wait a day or two or three, depending on the lab. With us, it'll be, 24 hours. With that being said, if it comes back negative, your kid's still sick. What do you do? So it's better to have all of that information at the same time. So when you get your COVID answer, you get the other answer so you can determine, how you're going to treat. So I think that's, what we looked at it. It's about really giving the physician all the information that they need to make a complete decision with a patient.
So that they can potentially rule out these respiratory illnesses. So are you potentially expecting some of these respiratory illnesses to ramp back up during the fall?
Oh, absolutely. Yeah. So we've already seen RSV ramp up in the summer, which is very unusual in the South. We think that, this is largely associated with a lot of kids. Kids, their immune systems are building up, but they've been at home for 18 months. They haven't been around stuff. And when that happens, you get a loss of immunity. And of course, that, when you start encountering those viruses again, kids are back in school, we expect that there's going to be a lot of RSV, a lot of flu. So we think it's going to be very important.
So how many volume of tests would you expect to be able to produce here to ship over to these organizations?
Yeah, so our capacity, we can do about 20,000 PCR tests per day. With our automation capacity, we can do about 1,500 CPAS and neutralizing antibody tests in the panel, and we can do about 5,000 of those respiratory. So right now, it's really all about the mix of who our clients are going to be and what the demand is. Obviously, if we run at capacity for any one of those levels, it's a very significant revenue model for us. And so what we're doing now is we're really optimizing who we're going to be engaging with nursing home facilities, schools, some government organizations that we're talking to who need large volume, and they don't have labs that have the capacity. We're kind of a new player coming in with large capacity, and so we can do big contracts.
So you are seeing this demand coming from them?
Oh yeah. Demand is definitely coming, and really more than anything, people know. In the second quarter, I think when testing volumes came down, a lot of people said, "Look, we don't need to deal with COVID anymore. It's not important." But obviously, those decisions have led us to where we are today. Not doing the testing, not tracing, not looking for those breakthrough infections. That's that has us where we are today. So I think going forward, it's become clear we can't dismantle that infrastructure. We need to keep that in place until we really get this thing under control.
Gerald, really great to catch up. Thank you so much for your time. Have a great weekend.
Thank you too. Have a great weekend.